set.
Okay. So, good afternoon, everybody. Thank you for joining the webinar this afternoon. My name is Debbie Bucci, and I'm the IT architect here at the Office of the National Coordinator for Health Information Technology, known as ONC. My focus at ONC is primarily on the privacy and security aspects of health information exchange. My aim will be to walk us through the presentation and hopefully address some of the questions we've received since the announcement of this challenge. If you have additional questions, please submit your questions in the chat window and we will try to answer them at the end of the presentation. ONC is a lead agency charged with formulating the federal government's health IT strategy and coordinating federal health IT policies, standards, programs, and investments. ONC supports the adoption of health information technology and the promotion of nationwide health information exchange to improve health care. The National Coordinator was created in 2004 through executive order and legislatively mandated in the Health Information Technology for Economic and Clinical Health Act, better known as HITECH of 2009. Slide 4 is a brief overview of the ideation challenge for blockchain. We asked by several times over the last few weeks what spurred the interest in blockchain for health. And proponents of blockchain suggest that it could be used to address concerns regarding the privacy, security, and scalability of health records. Critics contend that it would take an enormous processing power and specialized equipment that far exceed the benefits. We believe blockchain is in flux and still evolving. It may be too soon to assume standardization in the near future to address immediate needs, but perhaps you may know different. There's a lot of hype around the use of blockchain in general. We thought the timing was right to challenge those of you leading in this space to provide a bit more substantive information to react to. Here's a review of the submission requirements. You can apply independently or as a team. Understand that some of you are working on multiple submissions, but given the anticipated number of entries, only one submission will go through for final ranking to ensure diversity of participation and viewpoints. White paper should be no longer than 10 pages of content. That includes text, tables, and graphics. References will not count against the total. PDF and Word are acceptable. 2-point font and single space, 10-point font for tables, graphs, and there is no word limit. Has to be judged. A panel from NIST will score the submissions. The top 20 to 25%, it depends on the numbers of submissions, will be into an HH panel for final ranking. Others will be made public during the NIST workshop at the end. The submission date has been extended to August 8th. Winners will be notified the 22nd and publicly announced on the 29th. We hold releasing the actual papers to the workshop September 26th. The application process is pretty straightforward. Go to the website and follow the prompts. Next step is the opening the registration for the Blockchain and Healthcare Workshop. We have sampling of topics and presenters listed here. We'll hold off actually posting the final agenda until we have the winners and sort out the patient areas. That's about it. It's just a brief overview of the basics. We'd like to thank everybody for joining. Do we have any additional questions?
So nobody can actually talk, but if you go down to the Q&A section, and scroll down. The questions are in that chat box, and if you just want to scroll one by one and answer them, that's probably the easiest thing to do.
So, okay. The thing you answered about the plan to post the presentation on the website once this is done today. Do we plan to make the webinar available afterwards?
That is completely up to you. I'm recording it, so if you would like to do that, I can absolutely make that happen.
Great. We have to get 508 compliant and all that.
Correct.
Okay. Slide available, yes. I hope everybody can hear something. Are foreign European entities allowed to submit? The exact language is on the website. They need to have a place of business within the United States to be able to do so. I would say, I guess it's the EIN number, but they have to have a primary business here to be able to submit. Points will be published. Now, is the focus only on decentralized blockchain platforms? No. It's actually we left it broad and open. I know that we're looking to see. We don't know what we don't know, so we left it broad, and we must hear back how it's being used and applied. Results. Well, it's more exploratory. We do plan to put it into a formal proceedings, and we're sure of where to go for the next steps. Because as we understand, it's still very much in formation. So we're clear how far along the efforts are, and if there is any standardizations that I guess we need to wait and see. Too early to say about informing policy. Proof of concept acceptable or encouraged. Well, it's a white paper if you want to talk about your proof of concept, but there isn't any submissions of projects that we know of that for this. This is pure white paper effort. There's a word limit about the internet audio. I don't know.
I responded to those ones probably, let them know to call in on the event tab. The event tab has the dial-in information.
This kind of earlier, it says, how does ONC plan to act on the recommendations in the papers? I think this is more understanding on the research level, what is out there, what are the possibilities. I know that there's some work in DARPA and DHS, and I think we just want to see, to be able to assess how far along it is, and just sense. Repeat the submission and decision dates one more time. Glad to. Let me go back to the page. Here you go. The decision date originally was July 31st. We've extended it to the 8th. Will be notified on the 22nd. We'll on the 29th. But we hold off actually making those papers public until the actual workshop. And for the presentation, it's the exact same URL as the actual blockchain website for where you apply. Okay, let's go. And I'm going back to, let me go to my notes. So PDF or Word are acceptable. The preferred is 12-point font in single space for the actual text, 10-point font for tables and graphs, and again, there's no word limit. Is the audience primarily technical or functional? How much technical detail is desired in the white papers? That ONC has both a standards and policy arm. I would think both are acceptable, and it really depends on to the audience that you would want to get the attention. I think both are just as important. There is no listing of the panel judges and is that typically done, Josh? Do we typically list the panel?
We have listed them on some challenges and some we have not, but and I think once you nail down who the panelists are, it would be good to put them up there so people can see who the experts are who are judging.
Fair enough. And that piece we're actually coordinating very closely with NIST on what that is, who it would be. Owns the IP that's submitted. I would think the submitter owns the IP. Healthcare is a huge topic. Is thing in the interoperability roadmap that would be focused upon? What's the primary metric for judging? If you're looking at the interoperability roadmap, there are a number, I certainly don't want to lead, but there are a number of areas, ID, discovery, there's many things, trust, these are some terms that come to my mind when thinking about blockchain, but I certainly don't want to lead in that area. Primary metrics for judging. Some general, we have, I'll read out off of the slides that key transfer transformative value of the recommendations and the innovation and the potential for achieving objectives. I think for NIST that will focus on more the underpinnings, the technology and the technical merits, but there's also, that's why we've divided the judging between both. That, I mean, ultimately it needs to have more of a focus of what are the implications for health. Can you clarify on the submission limit? The original posting stated that 3 submissions per investigator team. Yes, and now it's unlimited to 1. Correct. So the original posting did not have any dollars associated with that. Allow the 3 submissions, but ultimately, depending on the number of submissions we get, ultimately only one of those 3 submissions would go forward. So, as I was saying earlier, that given the anticipated number of entries, 1 submission will go forward, but we're not going to discourage you for the 3 submissions. I know that many of you are working with partners. Are demos acceptable and will they review? So links within the white paper to demonstrate some of your concepts, I would think are acceptable. Canadian entities have the same restrictions. I'm assuming you're talking about the restrictions for actually applying for the challenge. Is that if you're through a company, you would have to have some affiliation in the United States, and I do believe it's a U.S. citizen. I don't know the exact wording at the moment. We will update this restriction in the FAQs, so I think we already did. We have a statement in that.
We'll look right now.
Okay, great, thank you. I'm a PhD student in the U.S. but do not work for the university. Can I still submit a white paper? Absolutely. Will potential candidates be invited to the evaluation? No, I don't think so. They will post the challenge results on their websites. I would think that's appropriate. These need to be implemented projects or more like white papers. More like white papers, not implemented projects. What level of technical expertise should we expect the judges to have? Layman, standard programmer, blockchain programmers. I would say experienced technical IT or a blockchain, whether it's actual blockchain programmers involved, potentially folks that are in that area, and I guess that leads to listing who are the actual judges. But they only have an underlying understanding of the crypto. On the diverse side, throw over this to the fence to the IT side, there will also be some elements that have more of the policy and want to understand the implications it could have to health and health IT exchange and data exchange. How deep do you want to go on how it works versus use cases and problems? I do believe that depends on the audience you're trying to talk to. You have both policy and standards focused. Will data-tested platforms be given more consideration than theoretical? I don't know. That's a very good question. I think each white paper would be evaluated on its own merit. All white papers submitted be available to the public. At the moment, I think we were just the winning papers. But I said it's something we could discuss and update on the website for certain. Does ONC plan to fund a future blockchain initiative with perhaps a cryptocurrency for healthcare? It's too early to even. Right now, we're just surveying the landscape. How high concept should it be on the technical side? Well, we'll have folks from others who are very technical that understand the crypto on one side. I'm an IT geek, so certainly, but on the policy side, I think it probably needs to be balanced. Any more info about what aligns with ONC roadmaps and priorities? The best place to find that is the roadmap and some of their goals between over the 9 years. Those, in the last part of the roadmap, they has some detailed breaks that you could look at. Also, we will take many of these questions and answer them more completely in the FAQs. Your white CC is listed. looking for an argument for or against certain implementations and the limitations of blockchains, or are we just looking for general ideas? Yes, I think we are looking for the pros, the cons, the capabilities, to really understand, to get a sense. I think it's all of the above, really. We're really trying to get a better understanding than more, to get past the hype, to really understand what the possibilities are, what the limitations are. Is really interoperability across these different various flavors. Can graphics be included in the white paper? Absolutely. I think it makes it more readable. But I mean, that's truly up to your choice. So, the is on health IT and health research. So this next question I think is applicable. Focus on diagnostics, therapeutics, possible interactions with drugs and clinical trials or research programs. Possibly all of those could be considered. And any aspects of medicine such as biology, immunology, disease mapping versus statistical. Leaving this broad and open for, I mean, it is what would like to share. Any specific thoughts on applications in the area of clinical research and data collection and clinical trials? So we'll welcome your thoughts on that. So admission limit of 30, but only possible to win one. Yes, correct. There now 3 submissions could be winners. Detailed description, explanation of blockchain. Can we assume basic knowledge? So part of the workshop, the way we've broken it out, we're trying to do a general level setting, bring in understanding some existing pilots and work that's going on in that area. So yes, I do believe you should assume there's some basic knowledge, and please do focus on the benefits of the technology for health. That's exactly where we want to go. Question regarding Chime. Instead of reading it out loud, I would say you should probably ask Chime. Just clarification, the white paper is not to suggest how blockchain could benefit healthcare generally, but we're to propose a specific use case application. Given it is to educate both, again, the policy and the technical, I think either are appropriate for this challenge. Concerned about IP, this seems to be a public disclosure if we submit. I'm sure I understand the question, but I would think it public only. The submission would be public only if awarded.
Correct.
About the technical and policy issues about blockchain and healthcare. Will you be looking into the likelihood of blockchain going into blockchain based on economic reality of the healthcare delivery system. To decipher that. So this is my personal opinion that blockchain seems to be an underlying, I call it, do we call it a standard? But like TCP, it could be that where it shakes out at the end is not going away. I'm not sure about how to answer this question. Some blockchain, it will be around. I do think so, but this is a personal opinion. I'm not sure how to answer that question. Correct. No, there's no word limit. Just a 10-page limit. The font 12 point. So it depends on how large you set that font, right? We assume that patient records are available from applicable sources, wearables, or that's where you're looking. We have assumptions at the moment. So the question was, can assume that patient records are available from applicable sources like Epic, Cerner Labs, physicians' EMRs, wearables, or that what you're looking to blockchain to do is interoperability. So interoperability is truly important, but I do not assume anything now. This is really more broad and open. We don't. 103 participants on this call. No, the margin size, I didn't even think about that. No, at the moment. I guess that's what gets a couple more extra words in. Wow, so we actually lasted about a half an hour. Are there any other questions?
So I don't know if you just answered this last one, Debbie, from Moish Kutanowski. What about state federal jurisdiction issues? I don't know what it means, but.
Well, and there are state jurisdiction issues now. Are saying the possibilities? Are you referring to trust around those issues?
In regards to either. It says he followed it up with in regards to how health functions at the state and federal level.
Well, that's good. I sense is you're alluding to the use of blockchain for like trust elements, possibly, because certainly it's complicated because different rules apply across state and federal and local areas and jurisdictions. So, knowing specifically what you're asking. And everybody luck. So, is that it? I'd like to thank everybody for joining as well. The number of attendance is wonderful. Just know that we've opened the registration for the workshop that will this evening, tomorrow morning. And we will hold off with the final agenda until we have everybody committed and understand awardees as well. I would like to thank everybody for joining, and I'm truly humbled by the interest and look forward to the submissions. Please enjoy the rest of your afternoon, evening. Thank you.